I do a large amount of chronic limb-threatening ischemia, especially in women. I have a big population of patients with wounds. So this is one woman, she's 83. She has these 3 different wounds all over her foot that are on the plantar. It's actually 4 different wounds, and they've been there for 6 weeks. And she's been getting wound care. And I have this remote wound care clinic that I run. And her ABIs are clearly very low. This is on her right leg. Her toe pressure is 30. I know that's not going to heal, and she has some evidence of disease. So we took her and did an angiogram here, and this is her pre-imaging. So you can see she has a SFA stenosis. She also has a popliteal occlusion in a couple of areas, and then this is her distal runoff below that. She has pretty good runoff, but it's not very robust into the foot. Or I can't make a picture that looks as good as Dr. Armstrong's over there yet. But I treated her with shockwave. I like the technology. I believe that in heavy calcified lesions, it works really well. So she had a purely endo procedure. We treated the SFA with a 5.5 millimeter balloon. We treated the popliteal artery with, I think, a 4.5 or a 5. Again, it's for vessel prep. I use it at low atmospheres of 2 to 4 when nominal is 6. So I get that good apposition, and this is her outcome. And she did really well from this. She healed her wounds up after about 4 weeks. And I think that that's really important. So where I use these is in the areas where I don't want to stent, like the knee, especially. Mm-hmm. So there is data that shows that in endovascular therapy, women do have higher complication rates and slightly worse outcomes. It's also important to remember that women with peripheral artery disease present later in life. They have more advanced disease typically when they present, and they have smaller vessels. It's thought that they present later in life simply because of the change in estrogen as they go through menopause. So the aim of this analysis was to look at these sex-specific procedural safety and efficacy data following intravascular lithotripsy. But again, these are these real-world outcomes, and when you're looking at embolization in men versus women, they have smaller vessels. A lot of times they'll have significant calcification. I worry about embolization. And really there was no difference in perforation, embolization, no difference in closure. And also you see a very good result in a significant difference in the final effectiveness, where you have this decrease from 82% to 30% in terms of the stenosis, and the final even being a little bit lower. Most of us use this as prep. I want to make that very clear because a lot of people don't use this device. This is a prep device for me. So when you're looking at this saying post IVL and then final, I typically go back and use a plain balloon afterwards or a drug-coated balloon depending on what I'm doing.